Okay, so let's talk about hepatojugular reflux. So, it is a clinical test that can help differentiate between different causes of different clinical presentation, like if it's a renal cause or it's a cardiac cause. So, let's take, for example, a case. So, a patient presents with edema of the lower extremity. Also, on clinical examination, there is splenomegaly, and there is also ascites. So there is shifting dullness and yeah, all of that on physical examination. So now we've uh, we've gained all of this data on clinical examination, but now there are different causes of these findings, these clinical findings. So for example, right heart failure can cause these. Number second, cirrhosis can cause these. Liver cirrhosis can cause these. So now, how do we know if these findings are caused by the heart, or if they are coming from the heart, these findings, or yeah, they're coming from cirrhosis? And so let's just dive into that then. So let's draw a diagram. So let's say this is the liver, and just gonna erase it for a minute. So, and this is the portal vein, and this is the hepatic vein draining blood into the inferior vena cava. So this is the inferior vena cava, and then it is opening into the right atrium. This is the right atrium, and let's say this is the tricuspid valve, and this is the left ventricle. No, the right ventricle. So this is the right atrium. This is the right ventricle, and from above we have the superior vena cava and also the jugular veins that are coming in. So so we so now how do we know that these findings are caused by the heart, if these findings are caused by the right heart failure or the or cirrhosis? So if these findings are caused by the heart failure, let's say that this right side of the heart is failing, right, so it cannot pump blood forward, all of that blood will back up into the right ventricle and then into the right atrium and then into the vena cava, the inferior vena cava, and also the jugular, let's say this is the internal jugular vein or just jugular veins, and also in the inferior vena cava in here. So all of these this blood will accumulate here, and backwards it will increase the hydrostatic pressure, that will result in leakage of fluid from the vessel, and that will result in ascites, which is fluid in the peritoneum, and also in the lower extremity. If this is the, let's say, the leg, and this is the vessel, increased blood here will increase hydrostatic pressure here, because there is obstruction to flow because of the right heart failure forward into the lungs. Then so there is a obstruction here. So all of this blood will also result in increased hydrostatic pressure in the vessels in the legs, and the fluid or the fluid will go out because of the increased hydrostatic pressure into the interstitial space, and that results in edema. Of the feet. So ascites, edema, and also here we have the portal vein connection with the splenic vein and the spleen. So that will result in splenomegaly, right? So this is the spleen. So the pressure will also back up here, and that will result in splenomegaly. Okay, so this was the reason for the increase in for these findings in a patient with what is that called? In patients with all of these findings, in a patient with heart failure. Now we take another example, and this time we say this liver. Here the liver is super cool and it's really healthy liver, but here let's say this liver is sick. This liver is sick, and the way it is sick is that it is fibrotic. Okay, it's really fibrotic. So what it means is that there is obstruction to flow. So if this is the portal vein here, this is the portal vein, it cannot flow through the fibrotic lung because there is increased resistance. This results in portal vein hypertension. So this will then the increased pressure in the veins, in the pulmonary vein, in the portal vein, would result in outflow fluid into the peritoneum, and that would result in ascites. And also the spleen, the blood will back up in the spleen here, and that will result in splenomegaly. And also in the feet, in the same way, it can result in edema of the feet. So, but one thing that is important here that differentiates it is that that differentiates it from the right heart failure. Like up to here, everything is really similar, but here we have the, let's say, the hepatic vein here, and it's draining blood into the inferior vena cava. And this is the right atrium, and this is the jugular veins. Okay, so but the blood will not back up here because the main problem here is the liver. Like the problem here was above the liver. Okay, it was the right atrium. Here it is the liver, so the blood here will be okay. Okay, because there is no problem with the right heart. So this is how it these are the differences between the presentation of the cirrhosis and the heart. So now clinically we can now make the difference between these two, between the right heart failure and in patients with cirrhosis, by if a patient presents with these findings, is it's something called the hepatojugular reflux. So in a right upper quadrant, so this is the abdomen. This is the abdomen, and this is the, let's say, the diaphragm. Below the diaphragm, in the right side, right upper quadrant, you will push the right upper quadrant, which means that you're pushing on the liver. So when you push the liver, this is the hepatojugular reflux we're talking about. So right upper quadrant, you push that will result in this fluid going up in the right atrium and also the jugular vein. So the jugular vein pressure will rise. There will be about greater than 3 centimeter rise in jugular venous pressure, and that confirms that the hepatojugular reflux is positive, and this is positive in right heart failure. And so on the other hand, if a patient is cirrhotic, and if you do that, if you push here the right upper quadrant, you push, you give the liver a push, then it will not result in increased JVP. And so this is how we differentiate, because there is no blood backup here. Okay, the blood is here backing up below the liver. So this is just a test that differentiates between right heart failure and cirrhosis if a patient presents with edema, splenomegaly, and ascites. So clinically, you can differentiate by this test. So hope this was clear. So this is cirrhosis, and the reflux here is negative.